So how do you know what you know? Maybe you've done all the prep work, maybe you've incorporated various brain-based learning strategies. So how do you really know what you know? And I would encourage you with this. The way you know what you know is if you're able to teach it. So take the information you're learning and practice teaching it. If you can explain it to someone, then you'll know what you know well and where your fuzzy areas are. And that's a great way to test your knowledge. So it's not enough just to know the information. How do you apply it? How do you use the information? This is one of the most difficult things for students, so I want to show you this triangle. This is the Bloom's taxonomy triangle, and basically, educators use this triangle as they are trying to determine whether students have a good understanding of the course content. So remembering is at the base of the triangle. And as you go up higher in the triangle, it takes more critical thinking. So if I wanted to test a student to see whether the student knew what a normal blood pressure should be, then I could write a question at the remembering level that just simply says, which of the following is a normal blood pressure? And the student would simply have to remember and recall what a normal blood pressure is. So that's really at the memorization level. If you go up the triangle to understanding, well, at understanding, you have to understand what that information means. So maybe I need to see whether that student understands whether a blood pressure is high or low. And so I might ask a question about that. But now we go to the applying level. If we go up one more, now I need to see, does the student know what to do with that information? And unfortunately for students, this is where most nursing tests begin, is at the application level. So you can imagine in high school and in maybe your freshman college classes that you would probably have many test questions at the remembering and understanding level. And so for a lot of students, the first time they've had an application level question, it's not been until they've gotten to their nursing classes. And so this is very frustrating and overwhelming for students. I've heard students say, before nursing, I got straight A's. Before nursing, I always had A's on exams. And so what happens is the exam questions in nursing are often written at the application level or higher to mimic what students will see on their NCLEX, on those national boards that they'll take at the end of the program. And so this is a huge leap and jump for students because they may not have ever had questions like this in the past.
For real.